All right, let's jump into this deep dive and talk about respiratory diagnostic tests. The ones you're going to need to know like the back of your hand when you hit those clinical rotations.
Oh, yeah. These are essential. I mean, think about it. You walk into a patient's room, they're struggling to breathe. What do? You got to figure out what's going on. And these tests, they're your roadmap.
Exactly. And we're going way beyond just textbook definitions here. I mean, we're talking about really understanding how these tests help you, you know, think critically, put the pieces together, figure out what's really happening with a patient's respiratory system.
Exactly. Each test is like a clue, and together they paint a picture of what's going on in the lungs. You're not just treating symptoms,
Hmm.
you're getting to the root of the problem.
So we're talking about tests like pulmonary function tests, ABGs, pulse oximetry, imaging. Then there are procedures like bronchoscopy, thoracentesis, lots to cover.
Yeah, yeah. Let's start with pulmonary function tests, PFTs for short. Um, I bet you've all heard of spirometry, right? That's like the foundation of understanding how well those lungs are working.
Right. Spirometry, it's all about measuring how much air a patient can breathe in and out.
Hmm.
And the key is how quickly they can do it.
Exactly, exactly. And those measurements, they give us some super important values, values that you really need to grasp as nursing students.
Okay, so we've got forced vital capacity, or FVC, basically the total amount of air, after a deep breath that a patient can exhale.
Right, it's their lung capacity. So if it's low, could be a restrictive lung disease, the lungs just can't expand all the way.
Like pulmonary fibrosis.
Exactly, yeah, yeah. Pulmonary fibrosis, the lungs get stiff, so a low FVC on that spirometry. Huge red flag.
Uh,
Then you've got FEV1, that's forced expiratory volume in 1 second. How much air can they push out in that first second? This one helps us see the difference between obstructive and restrictive lung problems.
okay, so someone with COPD, where the airways are narrowed, they might have a low FEV1 because it's hard to get air out quickly, but their FVC might be fine because their lung capacity isn't the issue.
You got it. And that's where the FEV1 FVC ratio comes in, helps us separate those obstructive and restrictive patterns. A low ratio, classic sign of obstructive lung disease.
So like if you're looking at a patient's PFTs and that ratio is low, it's like a neon sign pointing you toward conditions like asthma or COPD.
Exactly. And it's not just about recognizing that pattern. You have to understand what it means clinically. What are the implications for your nursing care?
For example, you need to make sure patients aren't using their rescue inhalers right before the test.
Yeah,
That could skew the result.
exactly. Got to get that baseline lung function, no cheating. And keep an eye on them after the test, especially those with really severe lung disease. Even simple spirometry can make them short of breath.
Now let's move on to ABGs. I feel like some nursing students get a little intimidated by these.
Arterial blood gas analysis, they can seem a little intimidating at first, but really they're like a window right into what's happening with a patient's, respiratory and metabolic status.
So we're analyzing a sample of arterial blood, and we're getting information about their oxygen levels, ventilation, how well they're getting rid of CO2, and their acid-base balance.
Exactly. So we're talking PO2, the partial pressure of oxygen, tells us how well oxygen is moving from the lungs into the blood.
And then there's PO2, the partial pressure of carbon dioxide. That shows us how efficiently the lungs are removing CO2.
Right. Crucial for assessing ventilation. Are they breathing effectively? Are those lungs doing their job getting rid of CO2?
Now we got pH. That tells us about the acidity or alkalinity of the blood. And here's where we get into acid-base balance. It's a little complex, but it's really important to understand how the body tries to compensate for those imbalances.
And bicarbonate, HCO3, don't forget that one, acts as a buffer to regulate pH. Like if the blood gets too acidic, bicarbonate steps in to try and neutralize it.
So interpreting ABGs, it's like detective work. You've got all these clues. You have to look at the whole picture to understand what's going on.
Yeah, you can't just look at one value in isolation. They all work together.
So for instance, if you see a patient with low PA2, high PA2, that could indicate a problem with ventilation, right?
Exactly. Could be something like respiratory failure. And if their pH is also low, now we're thinking respiratory acidosis. The blood's too acidic because they're retaining CO2.
Right. So those values are telling a story, and you got to be able to read that story and understand what it means for your patient.
Exactly. And as future nurses, you need to know what to do with that information. Like a patient with respiratory acidosis might need oxygen, maybe even mechanical ventilation. It's serious stuff.
Absolutely. So ABGs, they might seem a little intimidating at first, but once you get the hang of them, they're incredibly valuable for assessing and managing those really sick patients.
Couldn't agree more. Now let's talk about something you'll be using all the time, probably every shift, pulse oximetry. Seems simple enough, right?
Yeah, clip it on the patient's finger, boom, you get their oxygen saturation. But even with something that seems simple, there are things you need to watch out for.
Right. It's a great tool for a quick assessment. How much oxygen is attached to hemoglobin in the blood? Non-invasive, painless, gives you instant feedback. That's why it's everywhere, from the ER to the ICU.
But like our source material points out, pulse oximetry isn't perfect. It can be tricked, especially by things like carbon monoxide poisoning.
Yeah, carbon monoxide is sneaky. It attaches to hemoglobin even better than oxygen does. So someone could have carbon monoxide poisoning and have a normal pulse ox reading, even a high one, but they're actually severely lacking oxygen.
That's scary. So you can't just rely on the number on the screen. Got to look at the whole patient. Are they short of breath? Are their lips blue? Do those symptoms match the pulse ox reading?
It's like anything in nursing. Got to use your brain, your judgment. Pulse oximetry is a great tool, but it's just one piece of the puzzle.
Exactly. Now let's move on to imaging studies. We've got the trusty chest X-ray, the quick and easy way to visualize the lungs. It can show us things like pneumonia, fluid buildup, even a collapsed lung.
Yep, chest x-ray, your first-line imaging tool. Available almost anywhere and gives you quick information, but sometimes you need to see more, dig a little deeper.
Right, and that's where the CT scan comes in.
CT scans are like x-rays on steroids. They take these cross-sectional images so you get a 3D view of the chest, way more detailed than a regular x-ray.
So if we're suspecting something more complex, like a blood clot in the lung or a mass, a CT scan is often the next step.
And these imaging studies, they come with their own set of nursing considerations. For instance, before a chest x-ray, you got to make sure the patient removes any jewelry. Or if they're getting a CT scan with contrast, you have to check for allergies.
Right. Safety first. And you're monitoring them afterwards for any complications. Understanding the risks and benefits of every test, that's key. All right, let's talk about sputum studies. Getting down to the cellular level, looking at what's going on in the lungs.
Yeah, sputum studies, they give us a glimpse into the lungs, analyzing the mucus the patient coughs up. We can look for signs of infection or even cancer.
With a sputum culture, we can actually identify the bacteria or fungus causing an infection. Then we can choose the right antibiotic, the one that's actually going to work.
And with cytology, we look for abnormal cells. Could be a sign of lung cancer.
So let's say you're caring for a patient with pneumonia. That sputum culture can guide your antibiotic treatment. Or if you've got a patient with a cough that just won't quit, and they have a history of smoking, a sputum cytology might be ordered.
Right, different tests for different situations, but getting a good sputum sample, that's where your nursing skills are crucial. It's more than just spitting in a cup, right?
Yeah, you got to teach the patient to cough deeply from their lungs. Get that good stuff from deep down. Early morning is usually the best time to collect it, too.
And handle it carefully. We don't want any contamination.
All right, let's talk about a procedure that might seem a little more intimidating for both the patient and the nurse, bronchoscopy.
Bronchoscopy, yeah, this one is a little more involved. We're talking about inserting a flexible tube with a tiny camera on it into the airways.
It lets us actually see inside the airways, take biopsies, remove anything that shouldn't be there, even clear blockages.
Yeah, it's like minimally invasive surgery for the lungs. It can be used for diagnosis and treatment. It's super important in managing all sorts of respiratory problems.
As a nursing student, you might be involved in prepping a patient for bronchoscopy, monitoring their vital signs during the procedure, or taking care of them after.
It's important to understand the potential complications, like bleeding or a pneumothorax, and be ready to respond if anything goes wrong.
Absolutely. And let's not forget the emotional side of things. For a lot of patients, the idea of having a tube put down into their lungs, it's scary.
Oh yeah, you got to provide clear explanations, answer their questions, reassure them. It can make a world of difference for them.
Okay, and finally, thoracentesis. This is where we remove fluid from the pleural space, that area between the lungs and the chest wall.
It's a 2-for-1 procedure. We can analyze the fluid to see what's causing the buildup, and simply removing the fluid can help the patient breathe easier.
Right, so it's both diagnostic and therapeutic. As a nursing student, you'll need to understand the prep work, maintaining sterile technique, and the potential complications.
And afterwards, you're watching them closely for any signs of trouble. Pneumothorax, bleeding, infection. You're their advocate, you're their protector.
So we've covered a lot of ground here, from the basics of spirometry to these more complex procedures. But the key takeaway is that these tests, they're not just about memorizing facts for a test in nursing school.
They're about understanding the respiratory system, seeing those patterns of abnormality, and then applying that knowledge to take care of your patients.
You're building your clinical judgment,
Mm.
your critical thinking skills,
Yeah.
your ability to connect what you learn in the classroom with what you see in the real world.
And that's what makes nursing so incredible. You're always learning, always adapting, always using your knowledge to make a real difference in people's lives.
Yeah, it's like each of these tests, even a simple pulse ox reading, gives us a little peek into what's going on inside the body. Pretty amazing, huh?
It really is. It's like, we're detectives trying to solve a case. What's causing this patient's breathing problems? We got to gather all the clues.
Speaking of detective work, let's go back to something we touched on earlier, the difference between those obstructive and restrictive lung diseases. Super important concept for all you nursing students out there.
Oh, absolutely. It's foundational. And it's not just about memorizing definitions, right? It's about really getting how these conditions change the way the lungs work and how we can see those changes in tests like spirometry.
So let's break it down, make it super clear. In obstructive lung diseases, things like asthma and COPD, the airways are narrowed, making it harder to get air out.
Think of it like trying to blow air out of a straw, but it's partially blocked. It's harder, takes more effort, and you can't blow out as much air. And that's what we see in patients with obstructive lung disease, that prolonged expiratory phase. You can even hear it, when you listen to their lungs with a stethoscope.
And on spirometry, classic pattern. You'll see that reduced FEV1, meaning they can't exhale as much in that first second, and a lower FEV1 FEC ratio, showing us that airflow is obstructed.
Now, on the flip side, you've got those restrictive lung diseases like pulmonary fibrosis. Here, the problem is the lungs themselves. They're stiff and they just can't expand fully.
So it's like trying to inflate a balloon that's lost its stretchiness. You just can't get as much air in no matter how hard you try.
Exactly. So these patients will have a lower FVC because their total lung capacity is reduced.
Right.
Right. It's restricted.
But their FEV1 FVC ratio, that might be normal or even higher because they can exhale quickly. They just don't have that much air to exhale in the first place.
You got it. So when you're looking at those PFT results, really pay attention to these patterns. They can give you big clues about what kind of lung disease you might be dealing with.
And once you figure out what's going on, the physiology behind it, then you can start thinking about how it impacts the care you provide as a nurse.
Right. The nursing interventions. For example, a patient with COPD. They might benefit from pursed lip breathing, helps them control their breathing and prevent air trapping. But a patient with pulmonary fibrosis, they might need supplemental oxygen to keep their oxygen levels up.
It all comes back to connecting the dots, understanding the why behind the what. That's a big part of what you're learning in nursing school.
Absolutely. And let's not forget, we can't just focus on the physical stuff. Respiratory problems, they can have a huge impact on patients emotionally, too.
It's true. Think about it. Imagine suddenly struggling to breathe or getting a diagnosis like lung cancer. That's got to be terrifying.
It is. Respiratory distress is one of the scariest things a person can experience. And a diagnosis of a chronic respiratory condition, it can turn your whole world upside down. Affects everything. Your daily activities, how you see yourself.
Yeah, it's not just about the physical symptoms, it's the emotional and social stuff, too. Patients might worry about working, taking care of their families, even just enjoying the things they used to love.
And let's be real, there's often a financial burden too, right?
Yeah.
Managing a chronic illness, especially if it needs expensive meds or equipment like oxygen, it can be a lot to handle.
So as nursing students, you need to be ready to address all of that, not just the physical stuff, but the emotional and social needs of your patients, too.
Empathy, that's key. Really listen to your patients. Validate their feelings. Let them know you get it, you understand what they're going through.
And don't be afraid to reach out for help. Social workers, respiratory therapists, support groups. There are tons of resources out there that can help patients and families dealing with respiratory conditions.
Exactly. You're part of a team. You don't have to have all the answers. But you do have to be there for your patients, support them, and fight for what they need.
All right, let's switch gears a bit and talk about a concept that's becoming more and more important in healthcare. Patient-centered care. This means putting the patient at the center of everything we do.
Right. It means making sure the patient understands what's going on, involving them in decisions about their tests and treatment plans. We're talking about informed consent, shared decision-making.
Yeah, it's about giving them the information they need to make the best choices for themselves, choices that fit their values and goals.
For example, let's say a patient needs a bronchoscopy. You wouldn't just shove a consent form in their face and say, sign this.
You take the time to really explain what the procedure is, why it's recommended, what are the potential risks and benefits, are there any alternative? You'd answer their questions, no matter how many they have.
Exactly, and you'd respect their decision even if they decide not to have the procedure.
Patient-centered care, it's all about empowering patients to take an active role in their healthcare.
And studies show that it can actually lead to better outcomes. When patients feel heard and respected, they're more likely to trust their healthcare providers, follow their treatment plans, and have better results overall.
Now let's talk about something that's especially important for you future nurses out there, your role in promoting respiratory health.
Nurses, we're on the front lines. We're the ones who see patients every day, often before they even see a doctor. We have this amazing opportunity to identify those who might be at risk for respiratory problems, teach them about healthy habits, and encourage them to get help if they need it.
We might be the first ones to notice a subtle change in their breathing or, a cough that just won't go away.
And we're the ones who can ask the right questions, assess those risk factors, and provide support and guidance.
So for example, we can teach patients about the dangers of smoking, right? And help them find resources if they want to quit.
We can teach patients with asthma how to use their inhalers the right way, how to recognize the signs of an asthma attack before it gets really bad.
We can make sure they're up to date on their vaccines, things like flu and pneumonia.
And we can fight for policies that promote clean air and healthy environments, making it easier for everyone to breathe.
It's about being proactive, not just waiting for things to go wrong. It's about looking at the whole picture, realizing that respiratory health is affected by a bunch of different factors.
Right, things like genetics, lifestyle choices, social and economic conditions, what kind of environment they live in. It's complex.
And nurses can make a difference in all of those areas, both with individual patients and in the community as a whole.
For example, we can work with schools to make sure kids with asthma have the support they need, asthma action plans and stuff like that.
We can push for stricter laws to reduce air pollution in our neighborhoods.
We can educate families about secondhand smoke and encourage them to have smoke-free homes.
It's all about recognizing that respiratory health is a team effort, We all have a part to play in creating a healthier future.
Now let's talk about something exciting, the role of technology in respiratory care. There have been some incredible advances that are changing how we diagnose, treat, and manage these conditions.
For example, you've got portable spirometers now, so patients can check their lung function at home. It gives them more control over their own care, and it helps us spot problems early on.
And imaging has come a long way, too. You've got these high-resolution CT scans now that can show lung abnormalities in amazing detail. More accurate diagnoses, more targeted treatments.
And we can't forget about telehealth, right? It's making respiratory care accessible to more people, especially those in rural areas or who have trouble getting to appointments.
Exactly. Patients can talk to respiratory therapists or pulmonologists online now. They can get education and support, even have their lung function monitored without leaving home. Pretty incredible, huh?
It really is. It's breaking down barriers and making healthcare more convenient for everyone.
And it's not just about patient care. Technology's changing the way we teach nursing, too. Sim labs are getting super sophisticated, so nursing students can practice all those respiratory assessments and interventions in a safe setting.
They can practice putting in chest tubes, managing ventilators, dealing with emergencies, all before they ever see a real patient.
It's like a dress rehearsal for the real world. And online learning, that's making it easier than ever to keep up with the latest advances.
Yeah, you can watch webinars, take online courses, even do VR simulations. You can learn from anywhere.
All this new technology, it's more than just fancy gadgets. These are tools that are helping nurses do their jobs better, be more efficient, and provide truly patient-centered care.
It's an exciting time to be in nursing, that's for sure. And the future of respiratory care, it's looking pretty bright. So as we start to wrap up our deep dive into respiratory diagnostic tests, I want to leave you with a few thoughts, especially for those of you who are just starting out on your nursing journey.
This deep dive, it's just the tip of the iceberg, There's a whole world of respiratory care out there waiting for you. And we encourage you, don't be afraid to dive in. Keep learning, keep asking questions, and keep pushing yourself.
Find mentors, people you admire who can guide you. And remember, everything you're learning, it's not just about passing tests.
It's about using your knowledge to make a difference in the lives of real people. You have the power to help them breathe easier, live better lives, face their challenges with courage and hope.
It's an incredible privilege and responsibility. We hope you'll embrace it with all your heart. Now, before we go, we want to leave you with a little something to think about.
We've spent all this time talking about how to identify and treat respiratory problems.
But what about preventing them in the first place? How can we help people, individuals and communities, make respiratory health a priority so they don't develop these conditions in the first place?
It's a huge question, and I think it's one that nurses are in a unique position to answer. I mean, we see the impact of these conditions every day.
We do. And we know that prevention can make a world of difference.
So what does that look like? What can we actually do? Our source material mentions a few key areas, and I think smoking has got to be at the top of the list, right?
Absolutely, smoking. Still the leading cause of preventable death, and it's a major risk factor for so many respiratory problems.
Asthma, COPD, lung cancer, the list goes on and on.
It does. And as nurses, it's our job to educate patients about the dangers, to support them if they want to quit. We can provide counseling, connect them with resources, help them find a program that works for them.
And celebrate those successes, right? Every step they take toward quitting is a victory.
Exactly. Even cutting back can make a big difference for their lungs. And it's not just about individual smokers either. It's about protecting everyone from secondhand smoke.
That's right. We need to advocate for smoke-free policies, in workplaces, public places, even in our patients' homes. Creating those smoke-free environments, that's crucial for protecting everyone, especially kids and people who already have breathing problems.
Okay, so smoking is a big one. What about air pollution? I mean, it feels like it's everywhere these days.
It is. We're breathing in all kinds of pollutants every day, car exhaust, industrial emissions, you name it. And over time, that stuff takes a toll on your lungs.
It's pretty scary when you think about it. These tiny particles getting into our lungs, irritating the airways, causing inflammation.
And damage, real damage to the lung tissue. It's not surprising that air pollution is linked to all sorts of respiratory problems.
So what can we as nurses do about it? I mean, it feels like such a big problem. Where do you even start?
You're right. It's a huge problem. We're not going to solve it overnight. But we can raise awareness, educate our patients, push for policies that promote clean air. Even small changes can make a difference.
Like encouraging people to walk or bike instead of driving, right? Or taking public transportation.
Exactly. And supporting initiatives to reduce those industrial emissions, promoting renewable energy.
And on an individual level, we can encourage patients to stay inside on days when the air quality is bad.
Right. Use air purifiers if they have them, wear masks when they're outside.
So it's about tackling the problem from both sides, pushing for systemic change while also giving people the tools to protect themselves.
Exactly. Okay, let's talk about infection control. Those respiratory infections, things like the flu and pneumonia, they can be really serious.
Especially for older people, young kids, anyone with a weak immune system.
Absolutely. So hand hygiene, right. Got to be hammering that home all the time. Encouraging vaccinations, especially for flu and pneumonia, and teaching people how to cover their coughs properly.
Basic stuff, but it makes a huge difference.
It really does. And early detection is key too, right?
Right.
If someone comes in with symptoms of a respiratory infection, we need to assess them thoroughly, get the right tests, start treatment ASAP.
And for patients who already have chronic conditions like asthma or COPD, we need to be super vigilant about watching for any signs of an exacerbation. Are their symptoms getting worse? Do they need to adjust their meds?
Early intervention is key to preventing complications.
Absolutely. And let's not forget about patient education. When patients understand their condition, they can take better care of themselves.
It's true, knowledge is power. We need to empower our patients to be active participants in their own healthcare, and education is a big part of that.
So, teach them about their medications, how to use their inhalers the right way, how to spot those early warning signs, when to call the doctor.
And it's not just about giving them a bunch of information. We got to make sure they actually understand it, that they feel comfortable asking questions.
Exactly. Be patient, use clear language, make sure it makes sense to them, and be flexible. People learn in different ways.
Right. Some people like to read pamphlets, others prefer videos, some just want to talk it through. You got to find what works for each patient.
And remember, every interaction with a patient is a chance to teach them something.
It's true. Whether you're taking their vitals, giving them meds, or just chatting with them, those are all teachable moments.
So we've talked about smoking, air pollution, infections, patient education. What else can we do to really move the needle on respiratory health?
Well, we can advocate for policies that support healthy environments, access to affordable health care. support research to find new treatments and prevention strategies.
And maybe most importantly, inspire the next generation of nurses to be passionate about respiratory health.
Absolutely. You, nursing students, you have so much potential to make a difference. It starts with a commitment to learning, always wanting to learn more, and a willingness to question things, to think outside the box.
And a belief that prevention is possible, that we can create a world where everyone can breathe easy.
It's a big goal, but it's one worth striving for.
Well, that about wraps up our deep dive into respiratory diagnostic tests. We hope you found it helpful and maybe even a little inspiring.
We hope it gave you some new ideas about how you can make a difference, how you can be a champion for respiratory health.
Remember, this is just the beginning of your journey. Keep learning, keep asking questions, keep fighting for your patients.
You have the power to change lives, one breath at a time.
Thanks for listening.